We should be hopefully live now. Apologies that we're a few minutes late. We had some technical difficulties setting up. Hello and welcome to the first webinar in the two-stage webinar series run and hosted by DHI and the Specialist Social Prescribing Service in partnership with BAS and Baines Council. Just a very brief introduction on the Specialist Social Prescribing Service before I'm going to hand over to James, colleague from BAS, who's going to be presenting today. DHI's Specialist Social Prescribing Service launched in May 2021, and it was designed to offer holistic support to adults awaiting an autism assessment. Informed by working with clients who were having difficulties accessing specialist services, and with some clients feeling hesitant to access mainstream services, we've put together this short webinar series, and our hope for this is that it will be a refresher for probably most of you, or an introduction for some to autism and autism spectrum disorder. It's great to see that a good few people are logged in live already, and a lot of people have reached out to me and said that they are keen to watch this back afterwards, so hello to you retrospectively. In this first webinar, James will discuss autism, in a very general sense, and in the second webinar we will discuss making adjustments to better cater for service users and patients who identify as neurodivergent. I'm going to hand over now to James, who will be presenting for around 45 minutes. I'm going to keep an eye on the comment section of the feed so I can collate some questions, and we'll circle back to those at the end. James, I will just share your presentation and I'll be with you. So James, Facebook's decided not to let me share the slides currently. I'm not sure why. Do you happy to speak without the slides?
I can speak without the slides.
Sorry, but Facebook doesn't seem to want to be playing ball today.
Okay, if I could just then keep the slides somewhere so I can use
Sure,
it.
I'll bring them up on here.
Sure.
Sure, I'll let you introduce yourself and then we'll...
Okay. Hello everybody. My name is James Hennefeld. I am a social worker with the Bristol Autism Spectrum Service. And I hope you can hear me. My computer does say it's setting up my headset device. Yeah, and the best laid plans of mice and men. I had a PowerPoint all set up for this presentation, and Declan is telling me that he's having difficulty actually getting it available to you. So I would assume that we will make it available to you after the presentation. So you're stuck with looking at me for the next 45 minutes as opposed to having access to slides. I will have the advantage of, once Declan hands back his lap to me, I'll have the advantage of looking at my slides and delivering what's on the slides to you. But unfortunately, I won't have that for you as a graphic to access. Okay, here's my, I'll kind of make sure it doesn't get in the way of my, yeah. Okay, we'll get started right now. So again, I'm a social worker with the Bristol Autism Spectrum Service. What I'm going to cover in this presentation is an introduction to autism. I'm going to assume that some people in the audience are not particularly au fait with autism, so consequently, you may want, I'll start with some very basic concepts. At the same time, I'm also going to present information about the organization that I work for, the Bristol Autism Spectrum Service. I think the two are very connected because we, in the AWP area in the southwest of England, we are one of the main autism services, and we provide support for a huge amount of people. So as I do this presentation, what I'm hoping to also accomplish is maybe giving you guys resources for people with whom you work that have autism, because it still happens where I'll kind of meet people that didn't know we exist, and they'll be quite shocked that there's so much out there actually for people who have autism spectrum. So I'll be discussing BAS, my organization, as well as autism in general. I'm going to kind of lace the two together. I hope that's not too confusing or too difficult. If somebody also could just chat with, put in the chat saying they hear me, because I've got no feedback. Oh, Declan's giving me the okay sign, so actually you can hear me fine. Okay, so the thing about BAS, I'm going to start with some just basic information about the Autism Service. We cover what is AWP and the old Avon, so we work with people in Bristol, North Somerset, South Gloucestershire, and Baines. I personally am hired to work in South Gloucestershire, so I am the Autism Specialist Social Worker for South Gloucestershire. But like I said, we have our clutches in all the areas. We are primarily, we are about half a diagnostic team. So half of what we do is tell people yes or no, you have autism or you don't have autism. That itself, I think, is quite fascinating. Most clinicians, when they're going to negatively diagnose somebody, it's a positive thing. Hey, you don't have diabetes, or you don't have this or that, and it's a good thing. With autism, people, when they seek our services, it's often quite disappointing for them when they don't have it, because there might have been a set of problems going on in their lives that they were hoping to have an explanation, a framework to understand and point them in the right direction. So it's just a fascinating point, and one of the many fascinating things about autism, that people who seek our diagnosis actually want to be diagnosed, the vast majority. Part of that has to do with the fact that BAS diagnoses people 18 or over. So if somebody has gone through their education, schooling, and say maybe even employment, and there's been recurring problems throughout, and they're told, hey, maybe you've got this condition, the effort, the elbow grease it will take somebody to go through getting assessed for autism requires effort on the part of the person being assessed. So I think that has, often we're going to be meeting people who are experiencing distress in their lives, and I think that's one of the reasons why people are actually more upset when they don't get diagnosed than when they do. So that's our diagnostic services, and just very briefly, the pathway for that, in case you come across people who say, I think I might have it or my child might have it, is referral through the general practitioner, GP referrals. GP contacts us at BAS. We send out a form that asks them why they're making the referral, like which signs of autism are you observing. That gets vetted by usually our psychologists and psychiatrists. They then make a decision whether or not to accept the referral, reject the referral, or actually ask for more information. That's half of what BAS does. The other half is post-diagnostic support. Under that heading comes a wide range of things. And I'll go into some of that, but just a little bit about that in general is the post-diagnostic support that we offer, which is, I think, it's the part that I'm involved with. I think it's a wonderful thing that we have on offer, because not every area does. It redresses an issue that is historic, which is that people previously would get a diagnosis of autism spectrum, and not get any other information, just a letter from an assessor saying, yes, you've got it. If you think about it, if you get diagnosed with diabetes, you're at least going to get a list of foods to eat or foods to avoid. Traditionally, you didn't get that with autism, so you would just get the notice that you've been diagnosed. So we seek to redress that balance by providing support for people who have that diagnosis. Most of it is done by what we call an advice service, which is sort of a clinic or a drop-in center or appointment center where people can go. We have one in each of our areas in Bristol, Bath, South Gloucester, North Somerset. People can go there. They run usually 1 day a week, and we have a lot of activities and professionals there. We also create a safe social space where people can go to meet other people who have autism spectrum. I think that they're wonderful things. As a full-time social worker, that's only part of my job. During the rest of the week, I'll be helping people with benefits, job acquisition, and housing. As I like to put it, I help people with all things boring, all things that come within the social work realm. A lot of it is benefits, a lot of it is personal independence payments, universal credit, and ESA. Okay. Another thing that we do, another main part of BAS is we intend to upskill professionals who are working with people with autism about autism. So I will joint work with other professionals, or I will give consultation and advice, and not just to other professionals. It could be employers, schools, libraries. It could be anybody in the community that actually asks for our help. We will provide assistance to. And I think part of the reason for that is they say roughly 1% of the population has autism, although that number I think is going up. It's an old statistic, I probably should update my knowledge there, but say it is 1%. There's 250,000 people in South Gloucestershire, which means that presumably around 2,500 people at any one time have autism. I'm one person, I can't provide that much support, nor can the team, for those sort of numbers when you think of all of the AWP area. So our goal also is to impart training, understanding, skills and techniques to the professionals with whom we work, so that we can upskill the people that the other professionals that we work with, so that we are, since we're not in a position to do all of it, and nor should we be in a position to do all of it ourselves. So that's a very brief, I'm not going to my next slide, I can't say, hey, look at my next slide, but that's a very brief introduction to autism spectrum. A little bit more just about our support. We run some groups. The groups are both online and they are face-to-face. Now, when I said one of the main things, as we'll discuss about autism, is that people might struggle with communication one-to-one or in group settings. So what do I tell people when I meet them and talk about BAS and the great organization we are? What do I say? Hey, I've got lots of groups for you to do. You could imagine that that's not very well received. Yeah, the analogy I gave when I said earlier, when someone gets diagnosed, at least if you had diabetes in a diagnosis, they would tell you what not to eat. Well, telling somebody they've got autism and then offering them groups is like telling somebody they've got diabetes and then offering them a piece of chocolate cake. It seems very counterintuitive, but the bottom line there is I believe that we do groups right. The way we engage with people, I believe, is informed by good principles of working with people with autism, and I hope that if we can develop situations where people are confident or gain some confidence in group and other types of communication-based settings, that they will be able to generalize it to other areas that are less the BAS laboratory, the less the skilled professionals, whether they wish to join a club, go to a social event. I'm not quite sure. I haven't seen any research that says that you could generalize success from one interaction to another, but I'm hopeful, and I believe to a certain degree people can develop some confidence in those areas. So we also run a 6-session introduction to autism called Post-Diagnostic Group, which is not the most creative name for a group, but Post-Diagnostic Group, very well received, and it's one of our main commissioned resources. A lot of what we do, we sort of assess the ground and then develop our groups accordingly. But the introduction to autism group is something that our funding sources pay us to run and tell us that we need to run it. So we do run a 6-session introduction to autism group that we refer to as post-diagnostic group. During the COVID epidemic, we ran a coping during COVID group, which was a group just so people who were feeling isolated, unconnected, how they were reacting, how people with autism were reacting to the lockdowns. We also run some stress management groups, mindfulness, and problem-solving groups. More information is available about our groups on the BAS website. If anybody observing this webinar is in our area, wishes to learn about how to access the different groups, please contact BAS. We'd be happy to referring to us is dead easy. We've got a very simple referral form. For the NHS, I think we've got a very open-ended entrance policy. The way people can work with us is you have to be diagnosed with autism, over the age of 18, and live in one of our service areas. The one tricky thing that I've just mentioned, which won't sound tricky to you guys, is you've got to have the autism diagnosis. And that means we're going to need to see an assessment report. Why is that difficult? It's difficult because up until recently, there wasn't one standard way of telling people that they had autism. So what we've found sometimes just in GP notes, the doctor says, I think there's autism, and that seems to get passed on and codified. And for us in our funding streams, that's not sufficient. So often there will be people who will believe they've got this diagnosis because they were told by somebody, but there's never been a proper assessment consistent with NICE, National Institute of Clinical Excellence guidelines. So consequently, we would need to assess that person before they can access our service. That's a one little caveat about the ease of which accessing BAS is. I think for newer people diagnosed, that won't be an issue. These days, almost everybody is going to have been assessed using one of the standard tools that autism is assessed by, I think it's called the ADIR these days. But most people will have that diagnosis, and it'll be recognized, and it'll be consistent with what the NHS expects in order to receive support from us. And by the way, if you have any questions throughout this, again, Declan is monitoring the chat. So Declan will be collecting the chat. It's 12:23 now. I think probably at about 10 to 1, I'll force myself to stop no matter where I am in my presentation. Hopefully I'll be wrapping up at that point, and I'll be able to field any questions that you guys have. And feel free, there's no such thing as a bad question. I'm more than willing to answer anything that comes up. So feel free to ask Declan questions. He'll park them now and he'll give them to me at about 10 minutes to 1. Okay, my next slide. The slide asks how much people know about autism. I wasn't going to go around the room because there's quite a few people observing this webinar right now. But I'm assuming that there are going to be people within this group who have an extensive knowledge of autism, in which case this might, I apologize if it does seem a bit remedial, but it could also help consolidate things that people know already. And but I'm also pitching it at a level where I expect some people know almost nothing about autism, and this might be more helpful for people who are just trying to get some groundwork to move on from it and to support people. I would assume most people in the audience will, in some capacity or other, deal with people with autism. And so a lot of, even though this is going to be an introduction, some of it is also going to be techniques and suggestions for how to interact with people with autism. So that will be part of the presentation. Week 2, which I will also be assisting in the running of, or session 2, webinar 2, I'll be doing, putting more flesh on that bone, working with people with autism. Okay. Thing to understand about autism is that it is a neurodevelopmental condition. It's a lifelong condition. I find that to be really interesting. Because it's a lifelong condition, it doesn't mean that the level of disablement that it is causing at one time will remain consistent. How it affects people, how it interferes with functioning, can fluctuate. In both directions. We like to think that things steadily get better with input, with support, but I think things work in both directions. So some people may feel at times very well equipped and able to handle whatever life is throwing at them, and at other times things become more difficult. But it is a lifelong neurodevelopmental condition. It is technically also known as a developmental disorder. And I believe that term comes from the fact that part of its diagnosis and part of its identification will usually happen historically. There's a certain degree of developmental milestones that people with autism will not reach, usually around communication and responding to social cues. Part of our diagnostic process is interviewing informants, whether it's parents, partners, uncles, aunts, siblings, about the person's past. Because as a neurodevelopmental disorder, it is not something that is linked to nurturance and previous events, trauma, neglect, abuse, that sort of thing, or just having a difficult time. It's not linked to that. It is something that exists biologically, is our understanding, and will affect young people really as soon as they're having to communicate and interact with their environment. Personally, I think it makes it a real challenge when there is abuse and there is trauma and there are events in people's lives that are also going to cause difficulties in how they're interacting with the world. It becomes very difficult to actually sort out what is a neurodevelopmental disorder that would have been there anyway, and when there is like trauma and difficulty in one's previous background. I think that's something that the clinicians struggle with and have to kind of parse and look at a lot of people's presentation and look at a lot of historical events when they're making the diagnosis to figure out what is causing the difficulties that the person is experiencing. The way it will manifest itself is through social communication and interaction. Usually people with autism will struggle, and I say usually, there's a great researcher called Tony Atwood who's got this quote, if you've met one person with autism, you've met one person with autism. I always fling that about. It is true, so none of this is going to be for everybody, but we're talking now in generalities and what we look for. And for the most part, people with autism will struggle with social communication and interaction. A lot of that will manifest itself as anxiety in social situations and failing to interpret what's going on, failing to interpret the underlying meaning of certain communication. Often people with autism have said to me, there's this rule book in life, this rule book of how you're supposed to react, what you're supposed to say when somebody says, how are you feeling? And I never know. I never got that rule book. When they say, how are you? I don't know whether to say fine or I've got an upset stomach today. So a lot of the difficulty, a lot of the condition is going to develop around how to interact, how to interpret interactions successfully, how to understand what other people are thinking based on how they're communicating with you. What we find is people with autism will struggle with relationships. They doesn't mean they're not in relationships, but it will be a struggle. It could be a struggle attaining relationships, maintaining them, and also interpreting the nonverbal cues and the other really complex aspects of maintaining healthy relationships. Consequently, what people with autism will say is, I don't do groups or I don't do relationships. There will be a period of feeling burned by unsuccessful relationships for such a long period of time that people with autism will become more introverted and internal and entertain themselves through their own interests, which is one of the reasons why many people with autism will also develop special interests. This is something that's not necessarily part of our diagnostic procedure. You don't need to have a special interest in order to be diagnosed with autism, but we find that people get into sort of certain interests, whether it's computers, art, manga, comics, what have you, to an incredible level, and it will replace, to some degree, that need for social interaction by becoming extremely knowledgeable in certain areas. We also find that people with autism will become very repetitive in behaviors, very restrictive in new things and new interests. This is very common. There's a term for it which I've never liked called deficits in social imagination. So it's one of my issues with with terms, but generally speaking, what that refers to is the fact that predictable and repetitive behaviors are pleasing and soothing, usually for people with autism. And what will happen is that when there is an interruption to the predictable and repetitive behavior, it will cause a huge amount of stress and anxiety. So going outside of that comfort zone. Now, we all like our routines. If I don't have a cup of coffee by 9 o'clock every morning, I'm pretty grouchy. I like my routine. But there is a difference between being able to be flexible to adjust a routine, to letting the breaking of the routine become something that's overwhelming. People with autism, generally speaking, when a repetitive behavior doesn't happen at a specific expected time, place, it tends to cause more anxiety than it would in a population that is not experiencing autism spectrum. Often these repetitive behaviors are confused with obsessive compulsive disorder. They're two very different things. I won't go into the differences here, but I often spend time correcting professionals like, no, it's not OCD. We're not talking about OCD. We're talking about a manifestation of autism. And another thing that people with autism will generally have in common is sensory differences. This is quite significant for many people with autism. We refer to this as hyposensitivity and hypersensitivity. Hypo obviously being understimulated and hyper being overstimulated by certain sensory inputs. Meeting somebody new with autism, if I ask them, do you have any sensory sensitivities, they'll kind of rattle them off. Oh yeah, I don't like bright lights, I don't like fluorescent lights, I don't like white noise or whatever. It's not even if they haven't been known to our service and haven't had much education on autism, somebody with autism is usually pretty aware of what really sets their teeth on edge. So it is. It's just interesting that people I work with will know what they're sensitive to. I don't have to explain the concept to them. They will understand that already. Certainly as professionals, it becomes very important then when we're working with people with autism spectrum to inquire about that. And I'm usually very upfront, and I would recommend people are. I think it would demonstrate to somebody that you get it to that degree where you could say, do you have any sensory sensitivities? What are they? Obviously, there's the normal senses: touch, sight, sound, smell. There are other ones: vestibular, proprioception. I'm going to get some of this a little bit wrong, but in terms of how I'm pronouncing these. But it is not only the obvious senses. It could be how your body is positioned in the environment. Being aware of having that sensory feedback of how your body is. We find that many people with autism are dyspraxic, really struggle with physical movements and physical interactions. There is also interoception, which I believe is understanding what's going on inside. So it does feel logical that if somebody is struggling with their sensory inputs and isn't fully feeling their sensory inputs, knowing they're scared, lonely, depressed, anxious, happy, whatever that sensory input is. There could be a level of disconnection also from that sensory input. And I think part of the inability to properly interpret, modulate, and understand all the sensory input has something to do with the difficulty in reading other people. We read other people by understanding ourselves, and we're able to say, if I had that expression, or if I was moving through the environment like that, this is what I would be experiencing, therefore I can assume that's what that person is experiencing. If you're somewhat cut off from senses or under or over interpreting your sensual environment, I think then that it becomes hard actually to interpret your surroundings and read other people. Something else that I should point out about sensory sensitivity is that many people also have sensory hyposensitivity, that is under feeling of your sensory environment. We're familiar with people being oversensitive to certain things, but being undersensitive, not feeling touch or not feeling certain parts of their sensory input could cause risky behavior and seeking to increase the stimulation. Yeah, that could be why many people with autism find weighted blankets to be really helpful, because the weight on you stimulates what might be an understimulated sense of need for touch. I always tell the example of a woman I worked with years ago, who was sensory sensitive to food and taste to a huge degree, where her diet was incredibly restricted, yet she didn't feel pain as neurotypicals would. She told me a story where she walked around limping all day, and her mother pointed out she's limping, which she didn't realize. They had it examined, and she had a fractured ankle that she'd been working on for a couple of days. The point of that story is a person can be sensory hypersensitive and hyposensitive at the same time. Again, I think as professionals, it's really important that we're familiar with these concepts, because when we're meeting with people in a meeting room, if it's not got the correct airflow, if it's too bright, if it's not bright enough, we need to think about how we're going to be adjusting the environment. So, as we said, autism is a developmental disorder. What it is not is a learning disability, and it is not a mental health disability. I think it's important to get those points across. People can have associated learning difficulties. They can have associated mental health conditions, but it is not connected to the diagnosis of autism. Many people will have autism and not have any of these accompanying difficulties. Approximately 40 to, this is where I'm reading the slide, approximately 40 to 48% of autistic people are considered to have intellectual deficits, which is an IQ of less than 70. If you think about that for a second, that means that over half the people on the spectrum do not have a learning disability. If you think about how media has portrayed people with autism over the years, you would have thought that number is going to be a lot higher, but the majority of people with autism do not have an associated learning disability. Personally, I think that's a double-edged sword, that it is not a learning disability and it's not a mental health disability, because it becomes very hard then for people with autism without other accompanying disabilities to actually access statutory support mechanisms that are enshrined in law. And what I mean by that, a statutory service is something that must exist. So there must be child protection services, there must be mental health services, there must be learning disability services. Every council in the country has to have something, and will have money allocated for it. People with autism that don't have these other associated conditions are going to get the short end of the stick, because they will often not satisfy the criteria for a separate specialist service based just purely on the autism. So if somebody has autism and they're kind of low, getting depressed, often that depression will, sadly, will have to get to an acute level before they can access, say, a specialist mental health intervention. Of course, as with everybody in the population, there are the primary care services like doctors and some therapy, but it's not specialized, and it's not really going to be taking into account the needs of people with autism spectrum. So, the story of my life in the field as a social worker is working with people who fall through the cracks. And one of the things I will tell people with autism is, if you're going to genetically design a disability made to fall through the cracks, you would have a hard time coming up with something more effective than autism spectrum. That's a very sad indictment of our system, and also shows that an organization like BASS, where this is our population that we work with, we serve a huge function, but we're not a statutory service, so we don't care coordinate or case manage. Okay, here's where I would have stopped and paused to ask questions, but I'm going to keep moving on and take that towards the end. So the diagnosis is identified in both the ICD and the DSM. I wish now you had my slide, because we've got this like Venn diagram of two overlapping bubbles. wonder if I could just point it briefly to the camera. Do you think that would work, Declan?
Worth a go.
I'm gonna see if, I'm gonna hold it up, because I want you to see this, and then we'll talk about it. It's kind of weird, you gotta do the mirror image. But, this is useless. I think I gotta give up, because you can't really read that. Okay, I tried. That's my slide. Okay, but on one of those circles is social communication and social interaction. And on the other circle is repetitive behavior and patterns of behavior and restricted behaviors and interests and activities. When those two categories, when they interact, that overlap between those two are when a person does get diagnosed with autism spectrum disorder. So you need to have both. You need to have both the deficits in social communication and interaction and repetitive behaviors. Simply having one of those things does not meet the criteria, the diagnostic criteria for autism spectrum. And these differences, these conditions must be lifelong. They must present early since childhood. They must be pervasive, meaning that they are causing an interaction in many aspects of the person's life. That's why what we will often do when we're doing the assessments, we'll ask people about how many friends they have, how many significant relationships they've had, how many partners they've had, jobs, when these relationships didn't go right, why didn't they go right? It's a difficult thing because you're teasing out what would have been, say, social adjustment and attachment, things that can cause it that are not related to the autism. You're having to tease that out and come to the conclusion that autism is the reason that these needs aren't being met. And I think that's where looking at people's behavior, whether it's repetitive and whether it's restrictive and whether routines have sort of this elevated importance, is an important corroborating factor to understand that the social and communication interactions are not due to life events. It's really kind of complicated, hard thing to do, I reckon. Okay. Some just another general point is autism, support for autism is mandated by law. There is something called the Autism Act. There is also a government long-term action plan for people with autism. The Autism Act, by the way, is the only act of Parliament where the disability is actually in the name of the legislation. There is an Autism Act. There are newer iterations. I think Autism is the newest iteration of that, but it gets updated periodically. The government is currently using a white paper to look at reforming autism. There's a weird thing about autism that they're talking about in the latest government white paper of removing, which is, remember when I told you that autism is not a mental health disability? Well, that is correct. It is considered a mental disorder under the Mental Health Act. So although it's not a mental health disability for services in the community, if somebody is going to be detained in hospital, so-called sectioned under the Mental Health Act, autism does count as a mental disorder for that. So while it is a disability that does not automatically have statutory services available for you, it can also be the reason we lock you in a mental hospital. Go figure, it's a very strange thing. It's two separate things. So the law around services in the community and the Mental Health Act, which is the law that professionals will use to detain people and by depriving them of their liberty in a psychiatric hospital. Autism is sufficient as a mental disorder. Of course, the person detained will need to meet the other aspects of the Mental Health Act, but that person needn't have another mental health disability like psychosis, OCD, or bipolar. Autism is sufficient. And that's wrong. To me, that's a form of discrimination, and there is a white paper that the government is floating where they're going to hopefully remove that as a mental disorder. And it's quite the flavor of the month autism. There is national training going on from a high-profile case, which I won't go in here, the Oliver McGowan case, but there is due to the Oliver McGowan case, there is now national mandatory autism training, which is part of what BAS is involved with, and also an audit of how people with autism are treated in general hospital settings. Okay. Yeah, so while autism is not a mental health disability, it is associated with a greater risk of other mental health disabilities. So people with autism are more likely than the general population to suffer from other neurodevelopmental conditions, such as ADHD, dyspraxia. The slide says epilepsy. I did not know that epilepsy is a neurodevelopmental disorder, but I guess it is. When you have autism, people with autism are more likely to suffer from other neurodevelopmental disorder, as well as other psychiatric conditions such as anxiety, depression, transient psychosis, OCD. So whilst autism are not those things, people with autism are at greater risk of experiencing such mental health difficulties. I'm going to skip my next slide, which was something around stress, because it's something you're going to have to look at. In terms of suggestions on when you're interacting with people with autism, what we recommend is sort of reducing your demands and having a low arousal approach. Think of the sensory profile of the person that you're working with. Get as much information as possible to learn about how that person is interacting with their social and their some sensory environment. People with autism can struggle with nonverbal communication. I try to keep everything very black and white in terms of my interaction with people with autism, which is kind of weird because everything is an analogy, even black and white. To say be black and white is an analogy, but you get the point. There's people are going to get the very basic stuff. So, but be very concrete, very black and white, and do not assume that the people are going to get sarcasm, irony, and the more subtle forms of communication. And I like to also think about diversions. I like to ask people what their special interests are and give people a chance to talk about what they're interested in. Allow them to feel the areas that they have mastery over are positive and things that I will be genuinely interested in most of people's special interests because I think it's fascinating. I often will challenge other professionals so they are aware that the anxiety that people are experiencing and the demands that people with autism are placing on people, on professionals. It's important we challenge other professionals to say they're not being awkward. This is a manifestation of autism. There is a lot of general ignorance around autism, and I think it's really important for us to be able to challenge faulty assumptions about the behavior that people are presenting. I wish I had this slide too. So, but generally, the thoughts around autism are that it is genetic. It is passed on. We have noticed that people with autism will often have children who have autism, and the belief is it's just not behaviorally passed on through parenting and parenting styles. The belief is that subtle differences in genetics affect the way the frontal cortex of the brain is mapped out, and there are going to be differences in how the higher reasoning functions of the brain are going to be affected. I don't believe there are any tests that validate this. I think it's the behaviors that we're looking at and studies around genetics that give us this information. But we believe it is a biological condition. I often will tell parents, it's not you, it's not your fault, it's not how you raised your child. It is something that just exists. And it needn't even be a disability, it is just a difference. It's a disability when it's disabling. If we remove the reasons autism is disabling, it no longer needs to be considered a disability. But it will affect how people will, what we call theory of mind. People with autism, the way the prefrontal cortex maps itself, it will affect how people interpret behavior, how people are able to read what other people are thinking. Another concept we talk about is deficits or poor central coherence. That means that often people with autism will look at a picture, walk into a room, and focus on one small detail of that room as opposed to the big picture. Part of the diagnostic assessment that the BAS clinicians use are measures so people with one glance could tell what is the meaning of a large picture. Often when you do that with somebody with autism, they'll pick out one thing. If you show somebody with autism a massive picture, but maybe there's a car crash in the very center, but there's a lot of stuff on the periphery. Show it to someone with autism, say, what is this about? They might say, oh, flowers on a shelf or something like that. They'll look at one detail. This can be really useful for certain careers, like in computer programming, when you have to do things line by line and you're not really thinking about what the program's going to do. You're thinking about your line code. But it can also be quite negative because people can miss the emotional import of an important scene. A person can walk into a room where people are grieving or feeling bad about something, and the person with autism might say, you smell different today, or there might be something unconnected, missing that central coherent viewpoint, will then lead other people to think, oh, this person's insensitive. They don't care that I'm crying because my mother-in-law just died or something. They're just saying, they're talking about something on my desk or something that popped into their head. And again, that's part of us as professionals challenging other people. Well, no, this is kind of part and parcel of having autism. That sometimes people miss the central theme of what's going on. And part of these concepts then are how they manifest themselves in social difficulties, communication difficulties, and repetitive behaviors. So if somebody doesn't have good theory of mind, is unable to look at you and get a relatively good sense of what you're thinking, and they're not getting the good central coherence, what's actually going on, they're going to struggle to interact with you. You're going to walk away from that interaction perhaps feeling a bit unsatisfied with that interaction, and people will often then feel kind of lonely and disconnected. I've got slides on sensory stuff, but I'm going to skip that because it is already 12:53, and I want to save time for questions. I would love to keep going. I could have spoken for 2 or 3 hours on this topic and gone into greater detail. I'm looking forward to the second presentation, which Declan and I have finalized some dates for. But I think what I'd like to do now is, if there's any questions or feedback, I'd like to have Declan mention them to me.
Sure, so if it's okay, James, I'll just read them and you can kind of answer them into the camera. So there have been quite a few that have come through, people have been engaging, so thank you for that. We'll just try and get through as many as possible. The first question was, are the advice clinics that you mentioned as part of BAS's offering available to individuals not recently diagnosed?
Absolutely, absolutely. So if you wish to access our advice services, you actually have to have had the diagnosis and be over 18. It's not just people that we've diagnosed. Each advice service is run slightly differently. I could talk more about the one that I run, which is the South Gloucestershire one, which I won't do here. But call BAS, and certainly, yes, anybody who's got the diagnosis, who's over 18, who lives in our service areas can access them.
Perfect, thanks, James. I've just realised, because you've got your headset on, it might be useful if I ask you the question, maybe if you just quickly reiterate what I asked, just to make sure, or just in case. The next question was, do any of your clinics use music or art therapies?
Do any of our clinics use music or art therapies? No. I think there are music and art therapies that are often connected with mental health services. There are some activities in the community, user-run activities. I know there was a music group that was run by a woman who lives in Keynsham. I won't mention her name just in case I don't have my permission. There are some service user groups that might use music and art. And another amazing thing about working with people with autism is there's a lot of service user involvement, a lot of service user groups. We don't use them, perhaps we should, but we're not funded. I'm just glad for whatever funding I have, but we don't use them specifically.
Perfect. The next question was, is diagnosis easier in childhood? And what are the benefits of perhaps an earlier diagnosis?
Okay, is diagnosis easier in childhood or one of the benefits of early diagnosis? It should be easier in childhood, and certainly I think that is the experience of a lot of people, but a lot of people slip through that net and get misdiagnosed. There are reams of studies of people with autism who are misdiagnosed with bipolar and a lot of other conditions. You would have thought that education psychology would have picked this up and there'd be enough understanding. So while a lot of people are diagnosed early on, not enough are. Why is it important? Well, it is huge. The earlier the diagnosis, the earlier the intervention. For instance, graded exposure to risky or anxiety-producing situations is something that will be very helpful for skill acquisition. So while autism will not go away through drugs or treatment, through skill acquisition, people can develop mastery through learning. Okay, I'm in a social situation. Someone's going to say, "How you doing?" I have to say, "Fine." There's like some sort of social learning that goes on, and the earlier that social learning can go on, because it's not going to be intuitive. Neurotypicals, people without autism, these are intuitive communications. They're not necessarily skills that are developed. With people with autism, they have to learn it. So the earlier you learn the menu of skills that you have to communicate effectively, the better. So the earlier the interaction, the better. It should. We are a plus 18 diagnostic team, and we diagnose loads. So unfortunately, it doesn't get picked up enough when people are young. Next question.
Is post-diagnosis difficult for people?
Is post-diagnosis. In other words, is learning about the diagnosis difficult?
That's how I understood it, yeah.
If post-diagnosis is difficult, generally speaking, no. Generally speaking, when I ask people, and it's a question I'll ask, how did you feel about getting diagnosed? Majority of people say, I kind of suspected, or my mom suspected it, my wife, my husband, so forth. People are looking for explanations, and it is actually more, or less judgmental than other things. I'd rather be told I have autism spectrum than a personality disorder. People with personality disorders get a bad rap because events have happened that have damaged the personality. When people learn it's autism, it's often described as a get-out-of-jail-free card. It's not my fault. It's just the way my brain mapped itself. It's neither good nor bad. It just is. And if I didn't have autism, maybe I wouldn't have this incredible knowledge of World War II battles or something to that effect. So I find many people own their diagnosis. One of our topics in post-diagnostic group is disclosure. Who do you tell and why? And most people are pretty open about disclosure, about disclosing the diagnosis. Most people almost have a certain level of proudness about it. Not everybody, you can't say this across the board, but I think it's well received to learn that you've got autism spectrum. There was that recent, what's his name, Patty McGinnis, there's some recent guy on TV show, I didn't see it, where husband and wife and kids have it, and I think that also, people talk, it's created a big buzz. It's being demystified. Next question.
In your experience, what services or type of support make the biggest difference to people with ASD?
What type of services and support make the biggest difference? Varies, very much so. I'll tell you one of my tools that I use, and I really think people should keep track of this, is whether or not the person you're supporting meets the criteria under the CARE Act to have a care plan from the local authority. Although I'm a social worker, I'm not a local authority social worker, I'm an NHS social worker, which means I don't do CARE Act assessments and I can't release the funds. But what I think is a lifeline for many people is having a PA, personal assistant, or mentor, or somebody to engage them in doing that graded exposure and going out and doing things, whether it's grocery shopping, whether it's going to the cinema, whether it's going to any social event, doctor's appointments, or what have you. I think having a support worker is one of the most useful things, and it's not funds that I allocate, it's funds that the local authority allocates. So I work really hard to make sure that people who probably my local authority resents me for all the referrals I give them, but it's important that we understand the CARE Act eligibility criteria and that we are able to actually access through the CARE Act some sort of support worker to help people. It's huge. It's huge because many people are underskilled, will be living at home with aging parents, and that situation is not sustainable. Also though, for many people, accessing secondary mental health support is important. So a person may be suffering from depression, anxiety, and even more severe and entrenched mental health problems, but are not accessing mental health support. Again, as I said earlier, it's easy to exclude people with autism from those types of support. So I work very hard to make sure that I've got a good relationship with the mental health recovery teams in my area, and I make it two-way. I say, if you've got autism, people with autism in your caseload, send them my way, but I'm going to send people your way as well. But I think mental health support is also very, very important. If someone's at university, it's important to find out whether they've got a disabled student allowance, whether they've got support there. If someone's in work, I can arrange for some sort of job coach, work support. So, but I think having that extra person, somebody that they've got a relationship, somebody who understands their condition, I think is one of the most important ways we can support people with autism. And that might be your role. And if it is any of your role, my invisible audience out there, we will give you free consultation on how to support people with autism. So my role is upskilling those mentors and those trainers.
That links very nicely to the next question that I was going to go on to, which was, does BAS have an advice phone line for professionals?
If you're in our area, yes. If you're in North Somerset, Baines, South Gloucester, or Bristol, and you want advice, call the BAS general number. And this is kind of, I think, a huge payback. I mean, my local authority, which is South Gloucester, because I'm seconded into BAS, my substantive employers is South Gloucestershire. So for giving a full-time worker, which is quite a commitment these days for a local authority to give a full-time social worker to another organization, but the payback that BAS gives is the machinery behind BAS can be accessed by the local authority. So if social workers, psychologists, psychiatrists, OTs, if professionals in areas that are in our service areas want advice and support, just one quick example is I work with somebody on a mental health team, and the consultant psychologist spoke with our consultant psychiatrist for the mental health team spoke with our consultant psychiatrist about medication and behavioral issues of somebody that they were working with, so they can use us for consultation. I think that's really important because that consultation can be part of your CPD, and it's not just me and my perspective on things. I've got my own, I think, an advanced but somewhat limited perspective on autism, but you would have access to psychologists, psychiatrists, we've got a speech and language therapist, we've got OTs, we've got nurses, so we've got a whole huge stream of people that you would have access to if you're in our area.
Perfect. And would you mind, there was a question about the area, you touched on it, but just to reiterate, it's...
The area, it's the old it's the old Avon. So it's Avon Wiltshire Partnerships, which is the mental health trust in this area. So this covers South Gloucestershire, past northeast Somerset, North Somerset, and Bristol. Does not cover Somerset and Gloucester. They will have their own services. That can be a bit of a bummer for some people who are watching this, because I think our commissioning is more liberal than most. And it would be great if this was national. Often people tell me when they're moving out of area, hey, what do they have in, I don't know, in Bedfordshire? And I won't know, and I don't know if it's going to be as comprehensive as what we have on offer.
Perfect. I've just got a few more, James, if that's okay. Someone inquired about employment support. So is there such a thing as employment support for people with ASD or particularly kind of autism-friendly employers?
Yeah, first of all, the question is around employment support. A lot of employment support in terms of job coaching is going to come from other initiatives, whether it's through job centers or whether it's through the local authority. There are organizations that I work with in my areas. One is called Future Bright. but there are also mentoring organizations. So BAS, we don't provide, say, mentoring per se, but I'm familiar, in the areas that I'm responsible for, I am familiar with the job support that is available. At the advice service that I run, I also have a job acquisition specialist come about once every 6 weeks who will meet with people who are looking for work. I will help people with universal credit and accessing job centers. Something that I do for people in my area, it's sort of a one-off, is that I will go into businesses that have employed people with autism in my area, and I will give them a free consultation. Technically, I can't call it training because we have a trainer, and the trainer does something like an all-day thing, but I'll give people an hour or 90 minutes, and I'll title it, How to Get the Most Out of Your Autistic Employee. I've been to the Ministry of Defense, I've been to businesses all over the area. I probably shouldn't mention the businesses for data protection. But I've been to businesses all over the area, and what I'll do is I'll meet with the person who I work with, and we'll kind of create a PowerPoint together that I will then deliver to their managers and general people that are identified as needing to know. I'll do like a consultation on how to get the most. Now, I call it how to get the most out of your autistic employee as a way of kind of getting in the door. I'm really going on behest of the autistic employee, who may even have some gripes around failure to implement reasonable adjustments, which are identified in the Equality Act, but I'll get myself in the door. And, you know, it's not oppositional. People are glad to have me. Businesses are usually glad to have free 90 minutes of discussion on how to adapt the workplace for people with autism. So that's something that we will do at BAS. But in the bigger sense of having support in the workplace, we don't do that, but there are resources that are out there. The social workers for BAS should know what those resources are, and they're going to be very local. So I know what the ones are in South Gloss. I won't know what's out there in Baines and Bristol, for example, but I will know how to access support in the workplace for the people that I work with. Another point I'll point out is there is a government guaranteed interview work scheme. When you see a job ad that's got a box with a double tick in it, that means if you disclose your disability, you will almost always get an interview as long as you satisfy a very minimum level of requirements. It's a double-edged sword. I mean, the government's monitoring it, so you get an automatic interview, but does it mean you get hired? How is the organization going to feel about you having autism? So it ticks one box, but it might not tick the box of getting employed. But I often will discuss with those within my work about the usefulness of disclosing having autism at the interview stage, and talking about the supports that they need. Generally, the government keeps track of information of how many disabled people are in the workplace, and somebody who can be with a disability, who can be very good in the workplace and an asset to the organization, is a valuable thing. And so it's really important that we kind of destigmatize it, because it is true that people with autism are vastly underrepresented in the workplace.
Perfect. Final few questions. This might be quite a broad one, but someone inquired about the links between ADHD and ASD.
Yeah, it is broad. Someone asked about the links between ASD and ADHD, so autism spectrum and attention deficit and hyperactive disorder. I know there are links. I can't speak with any great detail about those links because I'm not a diagnostic clinician, and I would risk giving you poor information if I kind of editorialized and gave you my own opinions there. But what I will say is that there is a higher percentage of population people with autism and ADHD than just, you know, without the accompanying condition. Autism makes you at risk for, as I said earlier, a host of psychological and psychiatric conditions.
Perfect. And then the final one, which is, what is the current waiting list time?
The big question. What is the current waiting list time? I always think I could get a little side business by taking bribes to push people up the waiting list. If you're watching this, I would never do that. But I don't know is the answer. I think it is over a year. You gotta, what we did was we stopped doing diagnoses during the first earlier pandemics, which created even a larger waiting list. But we've also worked very hard on streamlining our process. So now when somebody is referred for diagnosis, the first thing they will do is they will get offered a triage clinic appointment. So we've made this layer, this triage clinic. The triage clinic can say to people, we don't believe it's worth going on to a full assessment because we don't see autism in your profile. It can also accelerate the diagnosis process. So if somebody, say, was diagnosed without a report many years ago, and they're clearly autistic, we can accelerate that assessment. And I don't know if they would diagnose on the spot, but they can do it much quicker, or the triage clinic can have people go to the full assessment from the clinic. So they've got options where they can say, no, you don't go on, or we're just going to give you the diagnosis right here, or we're going to move you to a full assessment. So the triage clinic serves that purpose. It's a really cool thing. Unfortunately, it's been online. I don't think it's gone to face-to-face yet, since it's not a part of BASM I'm intimately involved with. I don't know for sure. But we're working hard on our reports, how we can streamline our reports. We're working hard on how we can make the process with less of a waiting list. It's really important that we do that because taxpayers fund us and they don't want to wait 2 years for a diagnosis. I don't know if it is 2 years, but I'm just saying that we do need to think about that. It is incumbent upon us to make the waiting list as short as possible. Yeah, and that's that.
Thanks, James. That was the final question.
That's the final question.
I just wanted to confirm that the next date for the next webinar is the 17th of Feb.
Correct. The next date I've got in my diary. The next way you have to put up with my American drawl on the 17th of February. I don't know, Declan, could they send any feedback or things they wished I'd covered in this that I could address in the next one?
Sure. If anyone wants to drop me an email.
If you want to drop Declan an email, if there are things you're thinking, hey, he didn't talk about this at all, do that. And what I'll do is I will be happy to address anything that's come out of this. Again, feel free to contact BAS, with the situation that needs to be in our areas. Particularly if you're in South Gloss, call me, and I'd be happy to help people more individually. Okay, should I hit the end, or do you want to talk to them?
No, if you
Okay, I'm going to hit the end live video button. Bye, everybody. I don't know how I was.
Perfect. Thank you, James.